Not all lifts are the same. In this video, we explain the two main directions of facial lifting, vertical and horizontal, and how different treatments achieve each effect. From dermal fillers that restore projection and structure, vertical lift, to threads, microneedling (RF), HIFU, and surgery that reposition tissue, horizontal lift, learn how combining both approaches creates a balanced, natural rejuvenation. When we talk about facial lifting, it's important to understand there are two main directions, vertical and horizontal. Vertical lifting happens when we use fillers to restore lost volume and projection. This rebuilds structural support beneath the skin, creating an upward, natural lift, not by pulling, but by restoring what's been lost. This process inflates and supports the skin, giving the appearance of lift through volume restoration. Horizontal lifting, on the other hand, involves tightening and repositioning tissue. Techniques like thread lifts, microneedling (RF), HIFU, and surgery work laterally to counteract sagging and skin laxity. In most cases, both vertical and horizontal lifts are needed for natural, youthful results. That's because aging affects both support structures, bone and fat, and skin elasticity. Understanding the difference between vertical and horizontal lifts helps clinicians design more precise, effective, and balanced treatment plans. Thank you for what are your thoughts, Ching? Please comment, subscribe and share.